I'm talking today to Sue Pickering, who works here in Edinburgh. She is setting up the first PGD lab in Edinburgh. PGD stands for Pre-Implantation Genetic Diagnosis, which is what we call it. However, some people call it designer babies. Sue, I'm wondering if you could explain to me how your lab actually does help people.
Well, we use PGD to detect serious genetic diseases in people who have got a history of genetic disease in their family. So quite often they might already have a child with a genetic disease, or they might have had a number of miscarriages. So then what we do is we have to carry out fertility treatment on the couple. So we take the eggs from the lady and the sperm from the man, and we mix them together in the lab in a dish or a test tube. We then take the embryos that have been created, we take a single cell from each embryo, and we look at the genes in that embryo and look for the genetic disorder that's in the family. Once we've identified embryos that are okay, we transfer only those without the genetic disease back into the lady.
What kind of disorders does your lab screen for?
Well, we only screen for serious inherited diseases where there's a problem with the genes and the DNA. So things like cystic fibrosis, things that they're not very common, but they are very serious, and they usually have a really serious health problem with the child that's born with that particular disease.